Hi friends, let's have a short discussion on the differential diagnosis of pain in the right lower abdomen, or if we are making a diagnosis of acute appendicitis or any other disorder, what are the other common differential diagnoses which we should consider if somebody is having the pain in the right lower abdomen. So starting with the acute appendicitis, the four features of acute appendicitis are: the patient usually presents with anorexia, nausea, vomiting, mild to moderate degree fever, and there is a pain which characteristically migrate from the umbilical region to the right lower abdomen. There is a score that is known as Alvarado score to know about the chances of the appendicitis in a patient having right lower abdominal pain. The other differential diagnoses are Crohn's disease. There are two types of inflammatory bowel disease, that is ulcerative colitis and Crohn's disease. Ulcerative colitis is usually limited to the colon, while the Crohn's disease, which can occur from into any part of the GI system, the most common site is terminal ileum in the ileocecal region. The patient usually present with recurrent pain in the right lower abdomen. There is one condition known as Meckels diverticulitis. The Meckels diverticulum, which is usually present in about up to 2% of the population, is usually asymptomatic, but in some of the patients, there may be inflammation of the Meckels diverticulum leading to all the features of acute appendicitis. And if the appendix is normal, we should always explore up to 2 feet of the bowel to rule out if the common condition that is known as Meckels diverticulitis. In an endemic area of tuberculosis, or the patients who are having poor socioeconomic group, tuberculosis of the GI system can present as pain right lower abdomen. Tuberculosis, which can occur in any part of the GI system, the most common site is again ileocecal region, and the patient may present may have tubercular stricture, may have tubercular ulcers, so the patient may present with pain in the right lower abdomen. Volvulus of the bowel is, though the cecum is a rare site of the volvulus, but still it is possible to have cecal volvulus, and it is especially more common where the cecum and the ascending colon is mobile, that is, it is not retroperitoneal. So it's found in some of the patients. So cecal volvulus can be a possibility of right lower abdominal pain. In children age group or in adolescent age group, there is one common condition that is known as mesentric lymphadenopathy. The reason of the mesentric lymphadenopathy is usually viral in nature. So usually the patients have an upper respiratory tract infection. At the same time, the patient sometimes develop tonsillitis, and at the same time, the patients usually have lymph nodes enlargement of the mesentery, and that may present as mesentric lymphadenopathy, and this is more common in children and adolescent age group. If the patient gives you a long history of untreated fever, like suppose one month untreated fever, high-grade fever, we must also think about a common condition that is known as the typhoid fever. Typhoid, which is caused by the Salmonella typhi, its other name is enteric fever, because the primary site which is being affected by the typhoid is the terminal ileum. So if in an untreated patient, what happens is the patient develops ulceration or inflammation of the terminal ileum, and if untreated, it may give rise to perforation of the ileum. So if the right ureteric calculus is one of the very common conditions which presents with the right lower abdominal pain. Remember, there are two things. One is the right kidney stone and the right ureteric calculus. A right kidney stone, the patients usually present with right loin pain, that is, the pain is in the behind, that is in the loin. While if somebody is having a ureteric calculus, the pain will be in the right lower abdomen. Now, depending on the site and the location of the ureteric stone, that is upper, mid, or the lower, pain may even migrate to the thighs, pain may migrate to the genitalia. Psoas abscess, which is not a very common condition, we can say, but in endemic regions of tuberculosis, one of the common reasons of psoas abscess is tuberculosis. In the other regions, it can be caused because of this staph aureus or the other infection. So there is a collection of the pus around the iliopsoas muscle, giving rise to pain, difficulty in walking, and a particular posture being adapted by the patient, that the patient has the patient flexes his thighs, and the patient wants to keep the legs in the externally rotated position. And if you want to internally rotate the limbs, the patient has pain. That is an important sign. Now, there is some condition that may be associated with pain in the right lower abdomen, that is the inflammation of the cecum, and this condition is known as typhlitis. Or sometimes the patient can have diverticulum of the cecum, and there is inflammation of the diverticulum. Though diverticulum, the most common site is sigmoid volvulus, but rarely patient can have cecum diverticulum, and the inflammation of the cecum diverticulum can give rise to cecal diverticulitis. Very rarely, if the patient has got a testis which is undescended or ectopic testis, and even in those patients, if there is a testicular torsion, the patient may present as pain right lower abdomen. And obviously the muscle pain, musculoskeletal pain can be considered one of the differential diagnoses. Now in the females there are some other conditions which we have to consider when we talk about the pain in the right lower abdomen, like menstrual pain, that is painful menstrual cycle, or mid-cycle pain, that is at the time of ovulation the female develops the pain. Sometimes the patient has got severe pain. The patient may be having ovarian cyst, and usually it is not the ovarian cyst which causes the severe pain, but sometimes there is ovarian cyst torsion, or sometimes there is bleeding into this ovarian cyst which can cause severe pain in the right lower abdomen. Sometimes the patient may have pelvic inflammatory disease which may present as pain in the right lower abdomen, like the patient can have salpingitis, inflammation of the ovary, or inflammation of the fallopian tube. These can all give rise to pain in the right lower abdomen. Patient can have endometriosis, that is also a painful associated with painful cycle, and the patient can have ectopic pregnancy which may present as pain in the right lower abdomen. So this is all in short about differential diagnosis of pain in the right lower abdomen. Thank you.